Our main story this morning, there are fresh warnings today from doctors and NHS managers that accident and emergency departments are suffering their biggest crisis in more than a decade.
The College of Emergency Medicine, which represents A&E doctors, says units are seriously understaffed. Meanwhile, a group of English health trusts is warning the system could collapse within 6 months.
For most hospitals, the A&E department is the front line, where lives are saved every day. It's always a busy place.
Hi, Jacqueline Smith.
But the College of Emergency Medicine is warning the workload is now unsustainable.
Our junior trainees are no longer wanting to work in a specialty which really stimulates them, but they feel that they won't have a sustainable long-term career.
Accident and emergency departments like this one in Leeds are highly pressured places in which to work. More and more patients are coming through the door, resources are being squeezed, and there's a real problem recruiting and retaining younger doctors. And the body that represents more than 200 health trusts in England warns that after a long, hard winter, the system is close to collapse.
It's been very busy over the last 6 months. It's now getting better, but there's a real element about hospitals being worried that in a sense it's almost always winter in accident and emergency, and I think there's a real nervousness that unless we do something different and quickly, we will be in a position next winter where the whole system will fall over.
Super, thank you very much.
NHS England has already launched a review of how emergency departments are working and promised more money. Emergency services in Scotland, Wales and Northern Ireland are also being reorganised. Fixing A&E is becoming an urgent priority across the NHS. Dominic Hughes, BBC News, Leeds.
And Dominic joins us now live from an accident and emergency department in Stockport. Morning, Dominic. So, sort of alarms sounding about the state of A&E. Just how seriously do we need to take them?
Yes, good morning, Bill, from Stepping Hill Hospital in Stockport in Greater Manchester. I've got to say it's quite odd for me to actually be here this morning because a couple of months ago I was actually admitted to this A&E with a suspected heart attack, would you believe? It turns out it was just a football injury gone rather oddly awry. But I was able to see while I was here just how busy these accident and emergency departments are and how calm and professional the staff are working under those pressures. But what we're hearing repeatedly is that those pressures are building within the system. We've seen waiting times at A&Es across the UK building up. People have been waiting longer and longer before they're being seen. We're getting fresh figures out tomorrow, so we'll see what the latest data is. But these warnings, I think people will be taking them seriously. We know, for example, NHS England already has a review, has promised to pump in more money. We know the same is going on. Services are being reorganised in Scotland, in Wales, in Northern Ireland. So clearly the politicians and the organisations behind that work for them are taking these warnings seriously.
Dominic, thanks very much. Dominic Hughes reporting from Stockport.
We're going to be speaking to an A&E doctor at 7:10 here on Breakfast, and we'll put his concerns to the Health Secretary, who's talking to us at 8:10 this morning.